All right, we should go live in about 30 seconds here. And I'll send the link. Just setting up the meeting for YouTube Live. They're 15, 20 seconds. We'll go live. We're live.
Hi, everybody. Thank you so much for joining us today. This is the first of the DEM peer educational series. We're hoping to have a whole lot in the future. And today we're being joined with Dr. Jeffrey Hergenrather, Dr. Ethan Russo, Dr. Terry Willard, Dr. Stacy DeAndre, Leighton Morrison, and Dr. Holly Hall. And these are such a wonderful group of people here today that are gonna help sort of answer a lot of questions for people that are out there in this very difficult and challenging times.
Thank you, Marcus, for holding space for this. And we just want to, give a special prayer to everyone out there who is fighting, any illness at the moment or has family members that are, being challenged by this. And, it's our goal today to create space for knowledge and education, how we can build our immune system and make it through this. And we have different experts here that can really help us with that. So we're really appreciative of this time. If we're going to be on lockdown, at least we have this, time to share online together. So I think it would be nice for everyone to just introduce themselves for a moment.
And also, right before that happens, I think that I just wanted to say that this is such an incredible opportunity for humanity right now. We're being faced with something in this time period that humanity has never seen before. We are having a worldwide pandemic, and this is affecting pretty much every crack and crevice of humanity on the earth. So it's brought up a tremendous amount of heart issues for people and head issues and health and well-being issues. And I just think that as human beings, we are social human beings. We have been brought here on the planet to be social, to interact with people, to interact with each other. And each one of us has this beautiful electromagnetic field around each one of us. And we know that when we're in fear, that electromagnetic field becomes very small and dark. But when we're feeling love and when we're feeling appreciation and we're feeling kindness, that bubble just gets so much wider. It makes us more available for positivity to come into our life. And I just wanted to add that, there's an old Sanskrit term that said that there's only love and fear. Any other emotion is really based off of that. So I'm really encouraging everybody out there who's listening to stay in the love, because the love is what creates our healthy immune response. It creates healthy communication between people, and it really allows us to use our intuition. And as human beings on the planet and as earthlings, our intuition is one of the most strongest things that we have. So I encourage everybody to stay in the love.
So who wants to start? Ethan?
Yeah. Nope. Okay, so we were going to start with, did anyone else want to say something before we go into our presentations and talking? Okay, great. So we're going to start with Dr. Stacy DeAndre, and just go ahead and introduce yourself, Stacy, and let us know, what's going on with you in the world right now, and what can people know what's happening?
Sure. Hi, everyone. My name is Stacy DeAndre, and I am a medical oncologist. I practice integrative oncology as well in Sacramento, California. And we're on lockdown right now here in Sacramento. So staying in the home, everything's pretty much closed. It's pretty surreal and very, very challenging and difficult. Both of my kids, their schools closed. So they've been home. My daughter was at Boise State, and she's driving home right now. So they've closed the campus for the rest of the year. So a lot of colleges are closed, and it's very, very challenging for a lot of people. So this has been difficult for me, practice-wise. I'm an administrator as well, so lots of meetings, and I work for a very large health system, and we're really trying to figure out how to deal with this. So I'll talk a little bit about that as well. Personally, it's hard for me because I'm a toucher, I'm a hugger. And, you know, I was in clinic the other day seeing a new patient with a brain tumor, and I went in there with a mask and gloves. And she was coughing and had a mask on, and it was just like so difficult for me because that is not how I practice. And, you know, you can just feel the distance, and it's so challenging. We're moving into a whole new area of medicine now where I think, you know, video visits are going to become the norm, and I'll talk a little bit about that. But it's going to be a whole new world for medicine starting Monday, actually. So, but in any case, I'll talk a little bit about the virus. I'm sure everybody's inundated with facts, so I won't belabor it. But, you know, as everyone knows, coronavirus is an RNA virus that starts in animals. It jumped over to humans in China. And it's in a family of viruses that can cause the common cold, but also was associated with the SARS and the MERS outbreaks a number of years ago. We know that it's transmitted by large droplet particles. So when people cough or sneeze, large particles get dispersed through the air, and they go about 6 feet. So that's when you're in isolation or whatever, you're allowed to go out and walk around, but you want to stay 6 feet away from other people for that reason. The virus can infect the lungs. That's where it primarily does its damage, but then it can also affect the GI tract. So there's a small portion of people that do present with some gastrointestinal symptoms. The virus can live on surfaces. We know that it can live on cardboard and other non-porous materials for maybe about 24 hours, but then it can live on metal and it can live on hard plastics for 36, 72 hours, maybe even up to a week. So the type of surface, you know, matters. You know, so that's why everybody's saying, you know, wash your hands, try to clean everything. And that's a big part of decreasing the spread. The virus is also found in feces, but that's really not a common route of transmission. But, you know, another reason to just wash your hands. So at this point, you know, we know that 80% of the illness is mild, but 20% of people can get pretty sick. And that's one of the things we're worried about, our ability as a healthcare system and healthcare providers to care for the sickest people that are going to need hospitalization. You know, currently in California, we have 892 confirmed cases. In Sacramento, we have 45 cases. We've had 3 deaths. But, you know, we're at the very beginning of this. So it's just starting, and that's why you're seeing this push for people to socially isolate. This virus is pretty contagious in terms of the R0 value is how contagious is it? And what that means is one person can spread it to 2.5 to 3 people, approximately. If you contrast that to measles, which is highly contagious, that's about 1 to about 12 to 15 people. We can change that. So we can change that by socially isolating. If you look at the number of people that got the virus on the cruise ships, one person spread to 15 people. So if we socially isolate, we can reduce that, and also good hand hygiene. A lot of people are saying, and it's all over the internet, about flattening the curve. So what does that mean? What we're trying to do is let's spread out the number of people that get infected over a larger period of time so that we don't have this bolus of sick people coming into ICUs. Otherwise, we're going to get overwhelmed with the number of sick people. So if people socially isolate, we'll be able to spread this out, and we'll have the resources necessary to take care of people. And so that's why you're seeing a lot of shutdowns. You know, right now, what we're doing in our hospital system, which is a large one, we have no visitors allowed in the hospital except for extreme situations. So end of life, childbirth, but pretty much everything else is no visitors. And it's really heartbreaking. There are people outside the hospital with signs up, you know, for their family in the windows. And my mom lives nearby. She's 75. Her elderly neighbor, he is in a rehab center. He's 85, super frail, and his wife can't visit him. So, you know, it's heartbreaking for all of us to see this, because families are so important to each other for a support system when people are sick and we can't let them in. So it's really, really hard. All elective surgeries have been canceled. All chemotherapy, if we can put it off, we're putting it off. Radiation is being put off. We're screening people at the entrance. If they are positive for any symptoms, then they're sent to another place. So we're doing a lot of screening. I think the biggest thing that is happening right now is the big push for virtual visits. And that hasn't been a big thing in medicine because there's been a lot of regulations, but the government has lifted so many things right now that is allowing us to practice virtually. So by next week, we are going to have implemented virtual visits so we can do the same thing and keep our vulnerable population at home for the most part. I would just like to say a few words about the angst and anxiety that we're feeling as healthcare providers, you know, sort of on front or second line of seeing patients. And I think we're anxious about the unknown. We don't know what's going to happen. I feel like I'm on a Game of Thrones episode and the White Walkers are coming. And I don't know when they're coming, but I know they're coming. I just have this sinking feeling, and a lot of us feel that, but we're trying to stay positive. We're trying to really push social isolation because we can change this. If we act now and everybody does their part and supports each other, we can change the course of this. We're anxious about the need for medical supply, you know, for personal protective equipment. We really need to conserve that. There's a lack of supply. But also I'm concerned about my colleagues and other people, just any person in the healthcare field. Self-care right now is so important. People are going to burn out. They're going to work themselves into a frenzy. You hear stories, people are not sleeping. They're not eating well. You know, this is like just a recipe for disaster. So I'm hoping that people will take the time to take care of themselves. We need to sleep. We need to do some meditation. We need to breathe. You know, we need to do these things in order to take care of ourselves so that we can take care of patients. And I hope my colleagues will listen. But I think that's a really, really important point, is self-care during this time, and also supporting each other. There's a lot of things online. 2 examples. 10% Happier is a website run by this news guy, and he's offering a 6-month free membership for all healthcare providers. It's really awesome. They do meditations. They're doing daily, like 15-minute check-ins. And also Headspace is offering free 6-month subscriptions for healthcare providers as well. So those are things that healthcare providers can use even for 5 or 10 minutes to decompress during the day.
Excellent. Thank you so much for that information. We appreciate it so much.
It sounds so challenging and difficult, Stacy. I really appreciate you coming to us, not only as a heartfelt human, but also as a physician. And I think a lot of us are, you know, doing, you know, both. And because a lot of the people that are watching us today are cannabis, and we're using cannabis as a catalyst and as a conduit to reach all of these people, we wanted to move over to Dr. Ethan Russo to talk to us about the endocannabinoid system and what he knows as to how we can protect ourselves better. And
or anything else that's on your mind or your perspectives.
Okay. I'll see if I can share my screen. We'll try that. I think this is it. Share. And is that looking okay?
Looks perfect.
Okay, great. Well, this will be a little bit different. I would just start by saying that I've been very lucky. I live on an island. My life hasn't been that different, except for the decrease in travel. But I live on an island near Seattle, near the epicenter of activity. So life has totally changed here for most people. My email is up here. If people want to write to me for further information, please feel welcome. Most of what I'm going to talk about today is in this article that came out a few years ago. There's this general conception that all cannabinoids come from cannabis, and although many great ones do, there actually are many other plants that affect the system. And so this article was written in relation to that. And again, I'd be happy to send this to people, or you can just go to ethanrusso.org and have access to any of my articles. The endocannabinoid system, of course, is the main homeostatic regulator of human physiology. In other words, it's what helps to keep us in balance, whether it has to do with how we think or how our digestion is or modulation of pain. The ECS is involved. And there are all these different approaches to the endocannabinoid system. So if we were designing drugs, it could affect a variety of these receptors or have some effect on the amount of endogenous cannabinoids called anandamide and 2-arachidonoglycerol. Or there can be drugs that affect the breakdown of these products. There are also a few mimics in nature that look a little like THC. And then there are adaptogens. So these would be herbal agents mainly like ginseng that increase resistance to disease and help people under stress. One interesting one is kava. Kava has a couple of things in common with cannabis in that the main ingredients are lipid soluble. What we end up with is the stuff that looks like glue and, to truth be told, tastes like glue. And like cannabis, there's not one ingredient, main ingredient, but there are many, many cavalactones. But one in particular is really interesting. This is called yanganin. And it seems to bind to the CB1 receptor. And although at a very high dose, this could affect the COX-2 enzyme, like some nonsteroidals do, the doses that would be required are really high. But it could be that even a small amount of yanganin might be pharmacologically active, and it might have a role in the anti-anxiety effects of kava, which otherwise is used as a convivial beverage in the South Seas where it originates. Another one that's interesting is this, Radula, a couple of species, Parateti from Japan and Radula marginata from New Zealand, where I was last month. So this is a liverwort, a very primitive plant that was one of the transitions from the ocean to on land. And some time ago, it was noticed that these structures were there, but subsequent work has been done that shows that these substances resemble THC and do have binding to the CB1 receptor. I'm actually working with a company in New Zealand called Rua Biosciences that was started by the Maori indigenous people. And they're looking into possible cultivation of this plant, but this picture's really blown up. Each of these leaves is really tiny, and this is a rare plant, and it's going to be really unclear whether this could be commercialized in any respect and whether it has medical applications that are going to be different to what we get from cannabis. And then one of the receptors of the ECS is what's called TRPV1. And this is often associated with pain. Capsaicin in chili peppers is the most common associated thing that binds to this receptor, but also ginger and certain substances in black pepper, and of course, cannabidiol. Now, unlike capsaicin, which is caustic to the taste buds or on the skin, cannabidiol still stimulates this receptor without being caustic. And this could have a lot of applications. You can actually downregulate the receptor. You can desensitize it. And this is the reason that capsaicin ointment is used to treat nerve-based pain. Eventually, the receptor gives up and you can have a reduction. It also has a role in irritable bladder, interstitial cystitis, and prostatitis. Also in chronic pelvic pain, and certainly in fibromyalgia. It has a role in inflammatory bowel disease as well as irritable bowel syndrome, and also in pancreatic pain, one of the most severe types of pain that's very hard to treat. Certainly cannabinoids help there too. It also has a role in itch. Again, until recently, we said that the cannabinoids only came from cannabis, but actually well, geez, it's 30 more, almost 40 years ago, it was found in the South African daisy-like plant called Helichrysum umbraculogyrum that it contained cannabigerol and cannabigerolic acid. That one's always hard to say. We're finding that CBG is a very useful compound that's been ignored in cannabis until recently. It has a very, very strong anti-anxiety effect without being sedating or addictive. So it's quite different to things like the benzodiazepines that people commonly take for stress and can't get off of quite often. Additionally, CBG works on something called the TRPM8 receptor. So it's a target for prostate cancer in particular. And additionally, CBG is a strong antibiotic. It works on MRSA, the multiply resistant Staph aureus that causes hospital infections. And then there's beta-caryophyllene. So this is a terpenoid in cannabis, but common to a lot of other plants. But it has a distinction of also being cannabinoid. And even though it's a very strong anti-inflammatory, it protects the stomach from damage, unlike the non-steroidal anti-inflammatories that cause ulcers. Some time ago, Gerich and his team showed that this is a selective CB2 agonist. So it's working on the non-psychoactive cannabinoid receptor that modulates pain and inflammation. Right. And actually, there are lots of sources of caryophyllene besides cannabis. We see black pepper up in the corner here, but all these other plants have it too. So it's in Melissa officinalis, lemon balm. It's in cloves and could have a role there. And oil of cloves is used in dental procedures, and it's also in hops. So quite common compound. It's been used traditionally in South America for wounds and healing. Now, there's been a lot of controversy about chocolate. Chocolate has its own virtues, much beloved around the world. It was said erroneously that there were endocannabinoids in chocolate. The bad news is that there aren't. The good news is it does have a couple of compounds we see here that are Fa inhibitors. Fatty acid aminohydrolase is the enzyme that breaks down anandamide. So if you inhibit that enzyme, you're increasing the amount of anandamide, which should have effects that would be like a low dose of THC and would help with a lot of things, particularly anxiety and pain. Another plant that we don't commonly think of as having cannabinoids is this, Echinacea of various species. This is well known as an immunostimulatory compound or set of compounds. And these actually can work through the CB2 receptor, what are called alkamides. This may certainly be part of the way in which echinacea is anti-inflammatory. Also well known as a good thing to take when under viral attack, along with astragalus and things like elderberry extracts, but I don't have a tie-in to the endocannabinoid system yet for that. These substances also inhibit anandamide reuptake, so they could boost levels and increase an endocannabinoid tone. And they also target something called the PPAR gamma receptor, a nuclear receptor that affects gene transcription. Would be helpful for weight loss, but also the metabolic syndrome, etc. And there have been anxiolytic effects of echinacea reported in animal models. So a very useful and topical set of plant substances. Another one I wanted to mention, we call a cannabis mimic, is frankincense, the boswellia, and you see examples of the resin down below. There are four things that characterize THC or cannabinoid substances, and pain, basically immobilization, lowering of temperature, and fourth one's escaping me. But certainly boswellia does at least three of the four things. And it was used in ancient times, not just to increase a sense of reverence, but also as an anti-anxiety agent. It was administered to people before they were sent to be crucified by the Romans. It also has some neuroprotective effects, and if you don't have cannabis but you have access to it, it could serve a lot of useful purposes. Now, I want to transition into an area that Kelly is going to be treating. I don't want to impinge too much on her situation, but a lot of modern ills, I think, can be attributed to dietary indiscretions by humans. Really, we're extremely affected by the microbiome, the bacteria in our gut. And our microbiome is considerably different than it should be. And we know this from comparisons to people in other parts of the world, particularly in Africa, and to our primate cousins, if I may. We have a very low diversity of bacteria in the gut as compared to the way it's supposed to be. And we know that this is responsible for a lot of gastrointestinal disorders, obesity, and autoimmune diseases, and also it's been linked to anxiety, depression, and other psychiatric ills. So there's a lot of grist for the mill there. Well, what is a person to do? The easiest thing is use of probiotics and prebiotics. Most people have heard of probiotics now. So these are beneficial bacteria that would be in lacto-fermented vegetables, on things like good yogurt where it wasn't killed first, also in kefir and things of this sort, or it can be taken in capsules. But what the probiotic bacteria like to eat are what are called prebiotics. And these would be certain types of vegetable matter, usually indigestible sugars, fructooligosaccharides, and they're the feedstocks for the gut bacteria. One of the best is Acacia senegal that you see from heathers, but these others, burdock root, marshmallow root, slippery elm, are also good feedstocks. Why is this important? Well, there have been surveys done of obesity and cannabis use, and what it turns out is, contrary to what people think, due to the munchies effect of THC, obesity rates are lower in people that use cannabis regularly. And so there's a lower body mass index in regular cannabis users. And there's a reason for this. THC, although it may produce the munchies, actually alters the microbiome balance. And this was shown in this study. in DIO mice that are likely to put on a great deal of weight, that can be prevented by THC in the diet and how it affects the balance of bacteria. So we've got still this controversy. One depiction is the lazy slacker stoner. Another is the skinny hippie, and which is really true. Well, it is the skinny hippie. You know, actually, what we see on the left is the more typical example and the reasons why we've just discussed. And this is just showing more plants that are good prebiotics. One of the best is burdock, of course, but also things like dandelion greens and the more common Leucaena, garlic and leeks and onions, of course. Another thing I'd like to mention, and this really needs a lot more work, is the use of herbal bitters. Now, people generally take these because they allay hunger, but they also very much influence our choice of foods. And these are not just bitter in the mouth, there are receptors for them in the gut, and they've also been found in the brain, particularly in the hypothalamus. What we see when people take these is they often tend to lose a little weight if they need to, but it also changes their taste. They're eating less sugar, they're eating more bitter greens, things that are more naturally part of the human diet, or what it should be. The tie-in to the ECS is being something I'd like to work on in the future. Couple of books on how to eat, Good Old Nourishing Traditions by Sally Fallon, and a more recent book, Brain Maker by David Perlmutter. I'd just add that he's a little bit hardcore, totally avoiding carbohydrates, which I don't think is sustainable or natural. But anyway, there's still some very good advice in that book as well. There's this thing they call the gut-brain-skin axis, or what I'd like to call GUT, the grand unified theory of how the microbiome interacts with our brain, and inflammatory compounds like propionibacterium acnes that causes acne, but also has been associated with dementia and Alzheimer's disease. So I want to close by saying that cannabis is just one plant that modulates the endocannabinoid system, again, an innate homeostatic regulator of human physiology. But the ECS can also be influenced by herbal agents. Aerobic activity has been demonstrated to boost endocannabinoid levels, and particularly lifestyle and dietary factors. And that's it, and I hope we'll have time for questions subsequently. So I will stop sharing and see who's next.
Thank you so much, Ethan, for your time. That was beautiful, well thought out, very good information.
Yeah, a lot of stuff for people at home to attach themselves onto and help stimulate their immune system, and also hopefully find a sense of calm with this information. I saw that a lot of the stuff that you shared were published articles by yourself. So please, you know, Dr. Ethan Russo gave us a website that we can look at the beginning. You know, go and check out a lot of his publications. Incredibly amazing. And now we're going to move on to Dr. Jeffrey Hergenrather, because this seems like a perfect point for you to talk. Jeffrey, can you introduce yourself and tell us what's on your mind?
All right, thank you. I appreciate the invitation to be part of your gathering today, this assembly. Well, again, my name is Jeff Hergenrather. I'm a physician based in Central California, middle of California, about an hour north of San Francisco. And I've been in medical practice for about 45 years. Much of this has been with cannabis as part of my practice. Early on in my practice, I utilized cannabis before Nixon brought the drug war down rather heavily in the early 70s. And then I went on to a commune in the 70s and 80s where cannabis was freely used as medicine and for spiritual purposes, and it was working with those individuals, about 1,000 people, where I really learned an awful lot from the patients about how cannabis worked and what it was doing for people. Then from there, I went on to practice mostly emergency medicine for about 25 years. And then 21 years ago, opened an office specifically doing cannabis consulting. So seeing patients for cannabis use from infants and children to elderly people with degenerative diseases and dementias and so forth. So as a GP, as a general physician, I'm continuing to treat all age groups and with really a wide variety of different conditions. So that's a bit of my medical practice overview. Mostly I'm a husband, father, and grandpa, and spend most of my time, as much as my time as I can at home with family, but like Dr. Russo, spend a good bit of time also traveling around the world with invitations to come and talk about and teach about cannabis use. So I think something that is probably well understood, but I'm going to review it a bit anyway, is just the role of this natural endocannabinoid system, and having people understand that this is a system throughout the animal kingdom that's probably excludes insects, but other animals, from the sea creatures and little primitive animals like sea squirts and hydra and so forth, they've got the endocannabinoid system built in. So this has evolved along for something like 600 million years, helping animals survive. And by doing things like helping us to eat when we need to eat and helping us to sleep when we need to sleep, it has some very important restorative functions, helping us to relax and protecting us in a variety of ways, lowering blood pressure, dilating the airways and dilating blood vessels. It does a lot of things that just brings us back into balance. So these are very important roles. The cancer fighting roles are also very important, and we see a lot of benefits in oncology patients. In some cases, sadly, a rare few where cancers disappear, but in many cases where it seems to affect the progression of the disease, and certainly helps aid in the nausea, vomiting of chemotherapy, and the mood and attitude, and just helps the heart as far as people's use of cannabis in a lot of diseases of aging and with cancer as well. So this ECS, this endocannabinoid system, has evolved along. We've all got it. They're not all the same. And I think that's something that people really need to come to grips with, because it's an interesting way to look at the differences in diseases, is to look at the endocannabinoid receptors, particularly the CB1 receptor. We'll probably find this in other receptors too, like the CB2 receptors or the TRP receptors or others. But just looking at the CB1 receptors, the ones that are in our nervous system, the CB1 receptors cluster within different kinds of conditions. And there's quite a number of papers out there showing that cannabis, showing that these variations in the endocannabinoid receptor are seen in people with schizophrenia or with multiple sclerosis or with migraine headaches or with fibromyalgia or with seizure disorders or depressive disorders, and on and on. There are probably about 15 different conditions, maybe 20 now, that have been recognized as having similar cannabinoid receptors. So it gives us some recognition of why it is that certain inherited traits come down through the family. And I was just talking to a family today, and they have a teenage son who really is enjoying using cannabis, and they've gone to extremes to try to stop this use, sending him to wilderness camp for a year and sending him into therapy and so forth. And the kid still just finds cannabis is his drug of choice. It really comforts him. And yeah, as we're talking along, Dad had to admit to me, well, I've often thought that I have ADHD and his son has a diagnosis of ADHD. And it's been an interesting adventure for me in the last 6 months. I had the opportunity to join the team in Dedi Miri's laboratory at Technion in Israel. Miri's lab is one where they're doing things in cannabis research that's really unparalleled anywhere else in the world at this point. It's really wonderful to see a country where they embrace cannabis medically. It's not as free as it could be or should be, but it's different because when the government recognizes the utility of cannabis as medicine, it changes the conversations. Doctors can talk about it. Research is done, and it's really quite fascinating. So one of the areas that I find particularly interesting in this project of being in Israel is researching patients with ADHD. It's not a condition that qualifies for cannabis use in Israel, but it is a condition that we're able to see in the questionnaires that people fill out for their chronic pain or their cancers or their inflammatory bowel disease or whatever their condition might be. They fill out a questionnaire, and among those that are filling out a questionnaire, about 10% of them are admitting that they also have a diagnosis of ADHD. And in reading some of the neurobiology papers that are talking about mood disorders, including ADHD and depressive disorders, anxiety, bipolar disorder, these orders all have similar active areas of the brain, which are described in one of the neurobiology papers as the LCSPT circuitry, which is real active in these conditions. Those acronyms are for limbic, cortical, striatal, palatal, thalamic circuits. Well, these circuits are very rich in cannabinoid receptors. And when cannabis is used, these circuits quiet down and come under control. So the people with ADHD that I see in my practice for years and years are using cannabis often to the exclusion of stimulant therapy because they don't need it anymore. And we found this to be true in the patients that we evaluated in Israel as well. It was almost half of the patients that are using more than a gram of cannabis a day are able to change their medicines, and almost half of them discontinue their stimulant therapy altogether because cannabis supplies that need for them by calming the brain down and bringing them into control. So I find that really interesting about another role of the endocannabinoid system and how cannabis works so well in meeting those needs. There's another area that I thought was probably worth mentioning at this time when we're in our homes, which is wonderful for me. We don't have the ability to travel and go do some of the things that we might normally do. But I think taking care of business at home, taking care of our square inch is really an important element to this. And whether that's cleaning your second or third molars better, own them, take care of them. This is part of your square inch that you need to take care of. Or whether it's taking care of your garden or taking care of the trash or the things that need to be taken care of. These are things that I think help our lives and really help our spirituality in taking care of business. And I just want to give a word for that because I think it's often overlooked in our busy lives of running and finding things that are so important that we don't really take care of our square inch at home. And then another aspect of this that I think probably needs saying is we don't know how big a deal this is going to be at this point in the United States. Certainly in Italy and in China and Korea and other places, it's been dramatic. And yes, we did have something that was of somewhat similar magnitude a century ago in the flu epidemic of 1918. I lost what would have been an uncle, my mother's sibling died with the influenza of 1918. So it was big, and millions of people died worldwide. And so this really does seem to be the biggest thing happening since then in terms of our own problems that we're facing. I think it's relevant to recognize that we don't really have much control other than isolating at this point. We don't have any other good way to treat it. There's some interesting papers coming out just now about whether an anti-malarial drug or an immune modulating drug called hydroxychloroquine may be a valuable method of reducing the severity of this disease. It hasn't been clinically tested. It's just in preclinical research, but that's an interesting opportunity. But having said the fact that we don't know how big this is, I think we have to assume that it is and can be very big and devastating if it really is killing somewhere between 1 or 2% and maybe as much as 6% of the population that's infected. That's a big deal. And when we've been studying science for these decades, we know that the human population has just skyrocketed over these decades. We're in this exponential growth curve, and surely things are going to happen. And this is one of those things. There was a Native American that was here in our home probably 20 years ago now. And when he brought us into the sweat lodge, one of the first things he wanted us to do was to think of the worst thing that had ever happened to us in our lives. And this may occur for a lot of us in these coming months and weeks ahead. But we thought about it for a while, and finally he said, now what I want you to do is give thanks for that event, to appreciate how it helped you to become a stronger person. And these lessons that we get from difficult things are something that we need to think differently about and learn from the lessons of these difficult times. So I'll leave it at that. I am happy to take questions, and I just wanted to thank you for inviting me into this assembly.
Well, I had a question for you and Ethan, actually, because, we are using cannabis as a catalyst here, and we're talking about the endocannabinoid system, and we know that it can help people feel better in all different types of ways, especially people that, maybe are feeling extreme depression or fear during this time. Do you all have recommendations, how people can use it best to be able to fill up the endocannabinoid system so that they can get the most benefits out of it? And do you have anything specific for those people out there who are feeling, uneasy during these times, that may not have severe medical issues, but are just feeling super uneasy and having a hard time sleeping and feeling good? Can you answer that?
Well, I guess I'll go first. First, I think people should try to be proactive in taking control of their own situations with a good hand washing and hygiene and everything. Beyond that, with respect to cannabis, there's been some controversy about what's called a cytokine storm. This is a buildup of inflammatory compounds that can be associated with a COVID-19 infection. And it was recommended by French doctors that people not take ibuprofen or other non-steroidal drugs. So one of the questions is, could an alternative anti-inflammatory like cannabidiol be an advantage? Well, I think it certainly could be safer, but it's absolutely conjectural as to whether it would be helpful. Maybe. We do know that THC lowers the body temperature, so it could be an help with fever, but again, acetaminophen or paracetamol could do the same thing. For anxiety, CBD can help, cannabigerol can help, but none of this should be smoked. With a respiratory virus, that's not what people should be doing. But rather this would be a time for alternative delivery, either an oral agent or an oral mucosal agent, using a tincture, that kind of thing. You know, I wish I could say more about this. We know THC has a beneficial effect on herpes viruses, and long-term use actually is helpful in HIV and simian immunomodulatory virus, but immunosuppressive virus. But I wish I could say we could be more proactive there, but we just don't know enough at this point. Maybe other of my colleagues feel that they do.
I would have to agree with you as far as the inflammation that's associated with smoking cannabis. There is some edema and erythema of the airway in the smokers, and because the virus does target the lungs, I think we don't want to be contributing to that. At the same time, I think people that are regular users of cannabis are probably taking advantage, could take advantage of the use of cannabis orally. So as Ethan mentioned, other methods of administration, I think it is a good medicine. Really, the only places we've seen cannabis possibly contraindicated are in association with drug interactions. So one of those that we've known about for some years now is a drug called clobazam, which is an anti-epileptic drug. Excuse me, let me turn that off. This anti-epileptic drug is a drug that has a metabolite that reaches hundreds of times the normal level when high doses of CBD are used. So in conjunction with CBD, it can be problematic. It's extremely sedating and can be a difficult clinical challenge. So we're careful in that particular aspect of cannabis use. There's another aspect of cannabis use that isn't fully understood yet, but this is in immunotherapy and cancer. And some of the early research is suggesting that the immune modulating effect of cannabis may be interfering with the effect of immunotherapy. And this isn't really fully understood or explored, but it is an area that I think we have to be cautious. But when it comes to really any other use of cannabis, I don't think we have significant evidence that cannabis has a downside. It generally is very safe and effective for so many things. So if you're used to using it for your mood or your anxiety or for any number of other medical reasons, I wouldn't stop using it. Although with that caution that pulmonary use may be contraindicated under the circumstances.
I'd like to jump in for a second here.
Please do.
Please do.
And then you can just go ahead with
Go
your
right on,
introduction
Terry.
and everything.
Yeah.
To
Thank
go
you,
through
Terry.
some of those questions. The whole concept of the cytokine storms, that was very, very important when we had the SARS around because it attacked that group. In fact, you would have the people that would be the most vulnerable in that group were your teenage hockey player. These people are really, really strong immune systems. The one that we have right now, it doesn't affect those people. It doesn't affect the young people. It affects that target group, which unfortunately a large group of us are over 65 in this panel right now. We're the vulnerable people this time, but it doesn't seem to create the same cytokine storm. This is all over the map when you get into the herbal boards and stuff like that. People say, oh no, you can't use elderberry because it causes cytokine storms. You can't use echinacea because it causes this and stuff like that. And I have found so far that it's of zero concern. I do agree with both of you that you really shouldn't smoke it. You should take it mostly as an edible to a degree, meaning I think the most functional thing is to take it orally. But people who are long-term smokers, if they don't have a little bit of irritation in their lungs, they won't cough the mucus up. This is a disease where people actually end up drowning in their own mucus. And so if a person is used to having that irritant, you've got to kind of itch it a little bit. But here, the big caution is, again, it should be used very seldomly. And the thing that really helps here in this situation is the terpenes, the whole entourage effect. So if you're using it at a very low temperature vaporizer through a water pipe, which is quite easy to do these days, you can still get the terpenes and don't have the heat and don't have those things. So I'm suggesting the oral should be on a regular basis, but on breakthrough situations, the actual smoking would be useful for a certain subset of people. Again, this is mostly our healthy people, not our really frail people. So that was just comments of what was said. I do agree with the not smoking. Anyway, who am I? I'm Dr. Terry Willard. I was in clinical practice for about 45 years. I'm now retired, also in an island, almost in the Pacific Northwest. I'm on Vancouver Island, where I mostly do research, write, and run a college, Wild Rose College, Wild Rose Herbal College, where we teach people herbal medicine for many, many years, since the 70s. You know, back in the 70s, when people are asked, what is the best, is there a medicinal use for cannabis? The immediate knee-jerk response was, yeah, it cures cabin fever. Oh my God. We've got a whole country, a whole continent that are going to be suffering cabin fever here in the next little while. So we might want to take that to heart. Again, this can be done orally or whatever, but it does have that kind of, well, it puts a smile on some people's faces. And that's very useful, because going back to what Kelly said at the very beginning, when we have this, should I say, this dichotomy of fear and love, I really, really support the love and really suggest the fear is the biggest thing. And that's what's running this. I am under the impression this virus is nowhere near as bad as the fear that is taken along. I think the big fallout of this is actually the economical collapse that we're going to have is substantially going to go down in history way more than this virus ever was. Having worked through many different things, including the SARS, I was very active in the SARS, and several other viruses have come along. I am absolutely convinced we can overcome this with botanicals. It's fairly useful to note that over 90% of the people that got the cure rate in both Korea and in China, they use Chinese medicines along with it. Things to be able to bring the mucus out of their lungs. And there's many, many of those things that can be done, including cannabis if used properly. So really what we want to do is we want to look at that. I really want to go back to remind us what Stacy said, that over 80% of the people, in some places up to 95 in Korea, have mild enough symptoms that it's not significant. So we're talking a very, very small window of the population. Unfortunately, I'm in that population, so I am taking this seriously. So I'm really comfortable with the isolation idea. In fact, the big plagues we've had in the past, who were the most successful people? Oh, they were called chatelaines. You took your family, you put them out in the country, and you still worked in the city. You died, but the family lived. That was probably one of the best plague strategies that's ever happened on the planet. We go back 100 years ago to the Spanish flu, swine flu, those things. One of the biggest things that was done is they took people outside and made sure they got adequate sunlight and fresh air. So isolation doesn't mean you have to stay in what I like to call the cliff dweller dwelling, a 17th floor on an apartment building, you're staying in that apartment. You got to get out and have fresh air, even if it's on the balcony. But going for a walk, getting some sun, etc., has been very, very effective in the past. Enter stage right, vitamin D. I'm of a solid supporter that people should take vitamin D. Hey, I'm Canadian, eh? We don't get much vitamin D, even though I've been out in the sun all day today and being able to do that. I did have kind of an interesting situations happen in my life in the last couple months. In the fall, one of my biggest areas of research is medicinal mushrooms. And one of my older sons and myself took a tour through some of the mushroom manufacturing and growing places in Asia. And I was there for 6 weeks, 50 miles from Wuhan, as one of the biggest places we were. Out of that, we all got coronavirus. Probably not the same one, but we were 50 miles away from Wuhan. We're on bullet train, mind you, but we're going around to all these things. And we have found that we've been able to work out protocols for ourselves with coronaviruses. As we all know, there's hundreds, if not thousands of different types of coronavirus. But by far, the biggest thing that we have to do is help work on our immune system, build up our immune system. So most of the work has already been done. Most of the people who are dying have fragile immune systems. May that because of other conditions they have inside themselves, maybe age, etc. The other big thing we're finding out that this disease seems to affect electromagnetically very significantly. The largest groups of people, including Wuhan, all have 5G in the area. I'm not suggesting that 5G causes this. I'm suggesting that if you're around a lot of 5G, it kind of temporarily ages, electromagnetically ages your immune system to be 10, 20, 30 years older. So all of a sudden a 50-year-old looks like they're an 80-year-old to this virus. This becomes a very, very big clue. So it still comes down to our immune system. I want to repeat what Ethan said because it's so, so important. And I got to say that you guys were probably reading my notes before you did your talk because you gave almost exactly the same talk I was going to do. So now I can talk other ways. But it really comes down to how the immune system works. 70% of our immune system is in our microbiome. So the microbiome is really important. The best and most significant thing to work on the microbiome is diet, diet, diet. And then you can throw in a little bit of diet. Or should I say, we take out the dairy, we take out the flour, we take out the sweets and those kinds of things and eat a fairly fundamental semi-monk diet as it could be, but you could eat all kinds of foods. These diet things, I've known since I've got it. I got it in October. My wife ended up with it in late December, and my son, or late December, and my other son ended up in December too. And we really found out that with this, if we wandered off into any of those festive foods, dairy, flour, and sweets, our mucus would just fill up. So we really, really had to suppress those. These things are very useful to be able to work with the diet. Again, I'm really supportive of the terpenes or this entourage effect here. I also say my number one group of herbs of choice for this whole area are the medicinal mushrooms. And again, I was lucky enough to go to some of the best growing grounds in the world. Oh, you could imagine, I wrote books on reishi mushrooms. And being in Nine Dragon Mountain with over 1 million reishi mushrooms sitting there, being able to meditate with them, now that is a highlight of my life. I will suffer getting a coronavirus to be able to do that again because it's like top on the list. But if I had to tell you the most important mushroom for me, it's in the Pacific Northwest. And a lot of you are right now. It's turkey tail. It grows around here. Turkey tail will knock out this virus. It certainly worked out the coronaviruses in several different viral conditions I was with people over the years. Again, I run a very busy clinic. We had up to 15 practitioners in there. And certainly during the SARS, that was our biggest issue. I lectured all over the place on this too. Turkey tail really made a great difference. There is one mushroom that's probably a little bit better, but most of us don't have access to it. Certainly people in the Pacific Northwest does. It's the agarikon. It's a super gets rid of every virus that's ever come near thing. So is the turkey tail. And it's really, really heavily used in Asia. Of course, reishi really helps calm you down and it's antiviral. So the real idea is, I'm absolutely convinced by the way these medicinal mushrooms work on the ECS, very much so. I think a lot of the ones that have the polysaccharides and should I say triterpene groups in there work on the ECS. But it really shows us how they work in a different way. So I want you to imagine for a second that the receptor site idea is so great. There's so many chemical reactions. There's so many receptor sites to drain on. But I'm suggesting that the receptor sites work sometimes 3 to 10 times stronger by the electromagnetic vibration. That's the same reason the 5G is knocking it down than anything else. So soon as it's touched the ECS anywhere in the body. It lights up the ECS and that whole receptor site. I'm really saying by sticking only to the receptor site model, and I'm really invested in it, I really believe into it, but the biochemical lockup, the key and lock mechanism, that's so 90s. Really, we're now back into the electromagnetic frequency. So I want you to imagine for a second, these medicinal mushrooms would have like literally hundreds of different polysaccharides in it. And they have many, many terpenes, at least 5 to 10 different terpenes. Some are up to 450. You can look at reishi, for example. They enter into the system and they march into the digestive system. But not only do they have medicinal quality, they almost have a vibrational song that goes along with them. When I study with the shamans down in South America, that's the way they work with everything. These things have songs and they work with that. So I'm suggesting the reishi mushroom and the turkey tails going into the digestive tract and going, hallelujah, hallelujah, hallelujah. And the microbiome goes, whoa, this is a cool guy, man. He's singing to us. Not only that, he's taking apart parts of his body as a prebiotic and giving us all kinds of branch polysaccharides to eat. And so the microbiome is happy. If the microbiome is happy, so's the ECS happy, so's your immune system happy, and then we get a smile on our face. And that's basically how it works. So the medicinal mushrooms are extremely important for this. Yes, they trigger, they can work on the receptor sites, but some of these chemicals are so complex. We know if we put them in a test tube and put them in receptor site, they activate, but they're so complex to actually get to that thing. Nobody's ever worked out the absorption thing. Yes, it might be micropanocytosis. There's many different things that could work, but if it works on the microbiome and the ECS in the digestive tract to trigger them and the song that they sing, it's a much more logical thing. I consider these things living crystals because these chemicals, certainly a branch polysaccharide is absolutely huge. It can't absorb. It works really effectively. But if it's wrapped around a protein casing, it's 5 times more strong. Well, for sure, this is not going to, oh, that's a living crystal. So you better go back and watch the movie The Dark Crystal and see how that brings us forward to where we are now, that gives us a vibrational frequency that really works with it. So again, the ones I've been using quite a bit with this turkey tail, reishi, cordyceps. Cordyceps, by the way, dilates your bronchial tubes up to 4 times. That's why the athletes like it so much. The Garicon chaga is very good for this. And I like to use mushroom blends. So we put mushroom blends in almost everything we do here. May it be smoothies, may it be our coffee in the morning, et cetera, et cetera. Fortunately, we have a lot growing and we have good supplies in here. Vitamin C is really important. Vitamin D is really important. Quercetin. Quercetin is absolutely fantastic. In fact, there was a guy in Quebec here. He did a bunch of study around this back in the SARS thing, and he showed how it blocked the SARS. He did send 80,000 doses over to Asia to be able to work on the whole this last coronavirus, and it's been shown that it works well. If we want to protect ourselves and do the first stage, there's no question elderberry is still one of the best. It will help prevent the virus, but it only works up to a certain stage. In Chinese medicine, the immune system is split into 4 different levels. The top one is called Wei Qi. It's protective Qi. It's the ninja that's out there that helps protect you. It makes the virus bounce off you. That's what you want to do. If you can increase Wei Qi, you're in great shape. Now, if you increase it too much, it becomes an autoimmune disease, so it has to have something to fight. But echinacea, elderberry, they're excellent at this side. And I'm really glad, Ethan, that you pointed out how it works in the ECS. That's my biggest treatise these days, is most of these things, especially medicinal mushrooms, a lot of the herbs, they work on an entourage effect too. They're no different than the cannabis things. They work that, but it's the one that we're concentrating on right now. We've had very good results with alder catkin tincture. The alder tree, it's been extremely antiviral. I have colleagues that have been using it ever since the SARS outbreak back in the early 2000s, all the way through for almost every kind of viral thing. Interesting, there's research coming out of Korea that they've been using is fermented sea buckthorn berries. So again, here comes to that the probiotic function here. Fermented foods is extremely beneficial for them, but it looks like the sea buckthorn ferment has been very useful. Other things that grow in some of your areas on your island, I live on an island too, Ushnea. It's, you know, that the old man's beard, that kind of limey green lichen that hangs off the tree. Ushnea lichen has been very, very good here. So again, probiotics, prebiotics, fermented foods, all help the immune system. At the second stage, if it's actually trapped in your lungs and you're already there, then you need to have things that move it. In TCM, we use anything that have bulbs. So you can have the white part of the green onions, you can have garlic, you can have onions, you can have any of the lilies and stuff like that. They bring the mucus out of the lungs. The next best thing for bringing it out of the lungs is honey. Licorice is very good here. So the formula I've used for many, many years when I get that caked in mucus down there is, this is a great one. You take licorice root, you coat it in honey, and then barbecue it. And so it's licorice or honey glazed barbecued licorice, and you mix that with the bulbs. Usually in this case, you're using the bitter almond along with it, using the lilies along with it, you're using the different bulbs, garlic and stuff like that. And you make that as kind of a syrupy thing and have that way. Fritillaria is used quite a bit. And in this current thing, there's a very famous Chinese syrup called Pipacoa, which really liquefies the lungs and brings that out. It was used in really a lot of people. And another one that's really been used quite a bit is sea coconut, also nicknamed hairy butt formula, because it looks like there's a hairy butt on the outside of the label. It's being used, but it can be a little bit problem on cardiovascular problems and a little bit hard in the kidneys. So you have to watch how much you're doing it, but we've gone through a fair amount of that over the period of time. Mullein really works in the lungs. You can actually, this is one that has been used as a smoke, but you do it as a smudge, but the real traditional smudge of the First Nation people, and that's how I grew up. They would take a hot rock or something like that, and they would take the dried herb mixed with a little bit of water and put it on the steam. They would smoke the steam of it. Inula or Elecampanion, it's really good. We've been using an awful lot of the syrup like this. Is called lung cough syrup, and what it's got in it is it's colt's foot, Elecampanion, horehound, mullein, osha, blue vervain, and licorice. It will be able to liquefy the mucus. I'm not suggesting that these herbs here are working against the virus. They're working against the symptoms. I don't think anyone's dying of the virus, really, or very few. I think people are dying because they're frail and they're drowning in their own mucus. They can't get it out. Their system just doesn't have enough chi to push it out. So that's why in isolation, you should be going for the walk that was suggested by Stacy, stuff like that. Yes, you're in isolation, but you can still go for a walk in the sunshine. Maybe walking your dog is one of the best things you can do for this. Try not to be isolated completely and try to be able to get into the sun and do things like that. Astragalus is also extremely beneficial, this deep immune system. So I ran through a whole bunch of things really fast. Apologize for that. We can go into more of this in a question period if anyone wants, but I wanted to give you this herbalist doctor's point of view on how we would work with this. As much vibrationally, as much essential oils. And one of the biggest things that I've been using an awful lot whenever these comes along is flower essences. If I had to give you the #1 flower essence for this, it's red clover. Red clover helps you for fear. We have a formula up here called Rescue ER. You can't order it because all the websites are so overwhelmed these days. You can't even get any product out of here, like a lot of other supply places like that. But there are several companies that provide that. Pacific flower essences, they also have a yarrow protection one. If you take that, and they also have a red clover, when you put those two together and you kind of put up this vibrational shield that's going to help you both electromagnetically and virally. No, it's not going to stop viruses. It's going to calm down your emotions. So if there is one particular word that we need in this whole viral epidemic, it's called chill. And you know what? That is brought to you by cannabis.
Thank you so much, Terry.
Yay, Terry. And Ethan, I know that you have to leave, but there was one question that seems to keep coming up in the chat, is that people are concerned about utilizing CBD or cannabinoids with their current medications. Do you know if there's any confliction in this, or what can you say to address that? Also, Dr. Hergenrather, you might have some points on this as well. Oh, you're muted, Ethan. Sorry.
Yeah, Jeff mentioned the most salient point. The major drug-drug interaction with cannabidiol is with clobazam, and that's a drug that's primarily used in severe epilepsies like Dravet and Lennox-Gastaut syndrome. There also can be issues with valproic acid, which is a drug that doesn't play well with others, is best used as monotherapy. Jeff also mentioned in relation to immunotherapies for cancer, but I will be honest with you, I think that this has been largely overdone. The drug-drug interactions through the cytochrome P450 are usually only generated at extremely high doses of CBD. And that might be the case when it's used as an isolate. I'm fond of saying there's nothing that CBD does that isn't improved by at least a little bit of THC. And one of the reasons is the necessary dose of CBD goes down about 80% for many indications when there are other components present. So I wouldn't have people be so concerned outside of those caveats that have already been mentioned. I'm sorry, but I'm supposed to be in Austin, Texas, and because I couldn't be there, I'm going to give a remote presentation, and so I'll sign off. But this has been great, and I appreciate the opportunity to be with you. I'd like to send everyone a virtual hug. Namaste.
Thank you so much, Ethan, for being on today. Your words of wisdom just have gone so far, and so much of the research and where we are today in cannabis is because of your hard work, as well as Jeffrey's hard work, and a lot of people who have put in a tremendous amount of years. We just appreciate you beyond, and hopefully you'll come back for another one of the educational series that we'll be having on here, hopefully weekly. So
thanks again.
Thank you so much.
Jeff, did you have a comment on that?
I would like to make a comment about the drug-drug interactions that people would be wondering about. There's a tendency to look at a medication that might be metabolized by the liver in this cytochrome P450 pathway. And if the specific pathway of a particular medicine is involved in breaking down one of your pharmaceuticals, and it happens to match what pathways are used in breaking down THC, CBD, and other cannabinoids, there's a knee-jerk response to feel that, well, we shouldn't be using cannabis when we're using these drugs. I don't think that's the proper conclusion. The liver is very capable of metabolizing these drugs and normal doses of cannabis at the same time. So there really is no significant interference in most cases, even though the same enzyme pathways might be involved in breaking down a pharmaceutical and breaking down cannabis. So we don't really see clinically any problems with cannabis and almost any medication. The ones that have been mentioned, I would stand by as well and say these are more problematic with the clobazam and the others that we've mentioned. But I think that we tend to overreact, and I'll see articles published where there's a long list of medicines that are not doing well with cannabis, and it's just an overreaction that I think has not been really borne out in any clinical conflicts. So I would generally say no significant drug-drug interactions between cannabis and other pharmaceuticals.
Awesome. And Terry, I had a question for you. You were talking about the different vibrations and the different songs of the different mushrooms. And before I get into my talk about probiotics and the microbiome, I just wanted to know, what song does the psychedelic mushroom sing? So many people are microdosing. It's taken a wave. People are utilizing it for a lot of different things. What kind of role could, psychedelic mushrooms play in, what's happening today?
I think it's absolutely huge. And it was also used for cabin fever too, come to think of it. But besides that, certainly it works on depression, and it's uplifting to this whole system. So anything that's uplifting when society in general and the powers that be are trying to push us down is great. Anything that can cause levity. But you want to know what song it is? I have to say it's not a song, it's a symphony. It's got a little bit more going on than that, but the point is, I think there's many of the medicinal mushrooms, and I do classify some of the psychedelic mushrooms under the proper tutorage and sometimes under the proper guidage to be very beneficial. I'm really glad you used the word microdosing, because this is good for all, basically. There are some people that it shouldn't be, but it has a much larger therapeutic window than when you're doing heroic doses of the various psychedelics.
And can you give us a quick thought on colloidal silver?
Oh, thank you for bringing that in. I would have to say I'm almost categorically against it in general, and but not in this case. Okay, so I want to make sure. So really, when you're talking about colloidal silver is actually an antibiotic. So I've had patients use colloidal silver all along and literally turned like a tin man, totally silver, and hadn't used it for 5 years and still are totally silver. So it can overdose and you can't get it out of the system. So it's a very delicate thing. It is definitely strongly antiviral and stuff like that. So to microdose on it and use it when you think that you're suspect to it, yes. But I wouldn't want to be walking around the streets on a colloidal silver thing just in case I'm going to get a virus. You want to, if it's in your house or you think you're being exposed, there might be little bits of it. Colloidal silver can be used for a short window. It's almost too strong of a drug to be used on a regular basis. But they used to, in the old mansions, they used to have the silver spoon to do their tea. Enough microdosing of the colloidal silver got out. It's not the same thing, I realize, but it's enough of that vibration to get there. But yes, colloidal silver in microdosing over short periods of time.
Thank you so much.
And now I was just going to move into what we've all been talking about, which is the incredible benefits of a healthy microbiome. I believe that, we've all mentioned it here, and some of the stuff I'm going to do is a review and also mention some new stuff. We have 100 trillion symbiotic microbial cells inside of every single human. That's absolutely astounding. That's 100 times more than our actual genome, our genetic DNA in our gut. So one thing that I find is incredibly interesting is that if you look at the genome, there's 99.9% of us are very similar, are almost identical. But when you add in the microbiome, 98% of us are not identical at all. So I think that this is a really interesting thing. So does the microbiome tell us how we are going to feel? Is it going to tell us, how we react in the world? I believe that it does. I believe that these are incredibly intelligent beings that are inside of us. They're inside of our blood cells. Mitochondria is something that generates the cell inside of almost every single cell except for the red blood cells inside of our body. And mitochondria originally came from the air until it went into our body and became a generator in the cell. Now it doesn't live outside of the cell. It doesn't have that ability to live outside of the cell, but it continues this energy, beautiful process of dying and living and colonizing within the cell that actually gives us our energy. So there are main building blocks of all of humanity come from microbiology, which I think is just like tremendously Interesting. And then that really bears the question, you know, would we all be the same without our microbiome? And would we all be as intelligent or as stupid without our microbiome? So one thing that I wanted to talk about today is let's get a visualization of a yin and yang. We all know what that visualization is. You know, one side is the black side and then one side is the light side. And that it's a representation of balance. And when we talk about microbiology, we don't have maladies, we have health and well-being if there is a balance within our own microbiome of these pathogenic, heavily composting microorganisms, which we find in the anaerobic area, which is the dark side of the yin, or of the yin and yang. That's the yang side. That's the side that carries a lot of energy. And when you go into heavy duty composting piles and dirt and soil, the really very strong digesting microbiology in there that's breaking down organisms and different types of material are anaerobic, which I think is very interesting. So anaerobic microbiology has an incredible strength to it. And when it's out of balance, we are finding ourselves with tremendous amounts of maladies. Almost every, oh, I lost my train of thought there. So in a balanced microbiology system, we want to have an aerobic, which is these beneficials. These beneficials we can find all over the place. We're breathing it in the air. Lactic acid, bacteria in different cultures are being breathed in the air, like as I'm talking right now. And a lot of those are beneficials, and that sort of goes along with the probiotics that Terry mentioned, as well as what Dr. Ethan Russo had mentioned too, is that these probiotics that we can take, which is the bifidus, the acidophilus, the lactobacilluses, we can take them, but we have to continually colonize them in our body because they only stay in the upper digestive tract for 72 hours. So we have to continually take these microorganisms, as well as want to eat prebiotics that was also mentioned before, that is feeding this microbiology inside of our gut. And the more beneficials that we have inside of our body, I believe the more that we're able to think balancedly, we're able to think about happiness, we're able to think about love, we're able to think about creation. Because if you go back to the yin and yang, these anaerobic, heavily digesting, composting microorganisms are creating the balance within our body, because if we don't have those, then we don't have proper balance with beneficials as well. So this is, sorry, I'm losing my thoughts today. I think because all of y'all mentioned so many great things. But one thing we do find out is that with people with depression, 2/3 of the people out there who are tested for depression have a highly pathogenic digestive system. And that's not even testing necessarily the microbiology that crosses the blood-brain barrier. So with that yin and yang, we're going back to that sort of visualization again, is that these digestive organisms that are composting, they have a job. They have a job on the earth, and their job is to decompose, is to take apart things. And I find that people who are having an overabundance of this pathogenic microbiology inside of their body may have a hard time thinking about things that are more creative and more healthy and more wise, because they're filled with an intelligence inside of them that is about destruction, that is about composting, that is about, you know, renewing life in a different way. So if we have beneficials within our body, then it's the creation. So that blood-brain barrier that we find, you know, microbiology that crosses the blood-brain barrier is really microbiology that we can't necessarily find in, you know, over-the-counter prebiotic or probiotics, because again, I said that stays in our system for 72 hours. But where we do find these microorganisms that cross the blood-brain barrier that actually can colonize inside of our body from the very beginning is we find it in untouched virgin soil. So that's why I think that it's absolutely imperative for people to be gardening, to be out there in the soil, to be working with healthy soil microbiology, because this is the microbiology that has the capability to cross the blood-brain barrier, that stays with us for life. We get a tremendous amount of microbiology when we're born naturally through the vaginal canal too. And so many of us here are born via C-section or are born in hospital situations where antibiotics are given right at the get-go. Well, that loses our ability for that very basic building blocks of our microbiology, which protect our system and which protect our health and happiness. So if we go back to that vision of the yin and yang, we have beneficial, yin, white, aerobic, creation, happiness. They live in the sunshine, they live with oxygen. And then the darker, very composting, anaerobic microbiology is living underneath, in a non-aeration. And these type of microorganisms are the only type of microorganisms that can even break down processed foods and processed sugars. So we really need to feed our body with plant and material and food that's of natural sources, because then the biology within the body that is beneficial has that knowing how to break it down immediately. We don't have that knowing of beneficial microbiology that comes from nature as to how to break down sugars or these very difficult oils that we put into our body. So we start calling out for these heavy composting microorganisms that have to come into play that start then creating an unbalance within the body. And I'm really trying to say here today that that unbalance within the body can cause people to feel destructive, to feel like they don't have any creativity, to feel like they, are depressed often, because that's the intelligence of a composting microbiology. So the more that we fill our body with beneficials that come from the soil and also that come from plants that grow in the soil. So not only do we have a microbiome, but every single living plant that's healthy also has a microbiome. And when we talk about the inoculation of an organism that's going to stay in our body forever, these are actually some of those microbiology is found inside of healthy plants, which is called the endophytic reaction within plants. And when we are growing plants in healthy, beautiful soil that contain a tremendous amount of microbiology, then those plants have the ability to uptake that microbiology, and then you're able to digest it. And this is the type of microbiology that stays with us forever, that can be inoculated so that it keeps a balance between that pathogenic microbiology and the beneficial microbiology. So, to sort of sum it up, I think that it's really important that we oxygenate our body with exercise, which is what Stacy had been saying earlier. The more that we can get outside and exercise, it's really awesome. I do believe that in these times of stress, cortisol is a tremendous hormone that really puts our body out of balance. And I believe that it also can feed that negative or pathogenic microbiology. A lot of us are sort of loaded with this. So if we look at how we're doing as a whole human race on Earth and our health and well-being, because now this COVID-19 has had us questioning that. Like, how are we doing as a human race? Well, as a human race, we're really quite failing. And I believe that this is one of the largest failures in our health and well-being, is that we're not working with proper microbiology. And things that wipe out those microbiology are things that are just so common, which is all of the processed foods. A lot of pharmaceuticals, almost all pharmaceuticals, really hinder the microbiology within the body, as well as, not having very good thoughts or having a lot of stress in your lives. So if we can reduce the stress and up healthy vegetables and healthy fruits that are grown from healthy soil, then we're going to be able to, boost our healthy immune response by, having more beneficials within our body. And yeah, so I think that's about it. And I wanted to end too with what Terry was talking about, that, you know, mushrooms, they're incredible. They're one of those allies that not only help us boost the beneficial microbiology within our system, but they also kill pathogenic microbiology all at the same time, which a lot of antibiotics sort of go in and kill all of the microbiology in our body. And we really need to start allying with plants and different types of medicinals that are grown by nature, because our body understands nature more than this synthesized food and drugs that we've been, you know, living with for so long. So getting back to the soil, getting back to gardening, eating healthy, beautiful plants and fruits that contain microbiology in them that will stay with us for our entire lives is really the goal, so that we can all think better, we can have more love in our hearts, we don't have destructive thoughts. Because if anybody thinks that these microorganisms don't have intelligence, they are probably one of the most intelligent beings on earth. And I also think it's really interesting that, you know, governments have spent billions and billions of dollars on a defense fund. And now here comes in the tiniest and the most meek of them all. And we don't know how to defend ourselves necessarily in that way. So it's a pretty interesting, vision here on where we've been putting our energy. We have this incredible opportunity to put our energy into something that is much more important. And I know that a lot of the old scripts say that the meek will take over the earth. Well, you know, there's nothing more meek than microbiology. And that's what we're primarily made up of. So let's boost our beneficials. That's something that we can all do in our home by really stopping those processed foods, upping all of the good things, and, you know, the prebiotics that everybody was talking about, so we can all, you know, see this pandemic through with a lot of grace and beauty and love for each other and connection of all humanity.
So yeah, Louis, I think it'd be good to hear from people we haven't, maybe Leighton or Holly Hall. It looks like maybe Leighton is here.
Oh, Holly.
I just wanted to pipe in real quick. I think you did miss one key piece to this, Kelly, and that is the water. Fluoride, chlorine, chloramine destroy your gut biome. So we do need to spend a little time on that, but let Holly go first, and hopefully I can squeak one in really quick at the end.
You know, it doesn't look like Holly is with us anymore. So yeah, absolutely, water and what we're doing to our soils. You know, big ag, big pharma, as well as big education continues to push these ideas forward that, you know, synthesized things are much better than nature, when nature really has all of the answers for us, and water being the number one. And since COVID is here and we're all going to be at home, Leighton, I would love to hear what you have to say about how people at home could, you know, have more clean water.
Great. I started down this rabbit hole on Monday, and, you know, I figured by Monday afternoon I'd have it pretty much wrapped up, and I've still got tons of research to do. These compounds are pretty complex. We'll start with chloramine. Well, actually, let's start with the easy one, chlorine. Chlorine is very easily gassed off. You can just bubble it, or you can let the water sit for 3 or 4 hours and the chlorine will come right out of it. More complex is chloramine. Chloramine is chlorine mixed with ammonia. Both of them are toxic, and they're very difficult because they bond to the water molecule in a bond form called ionic. So it's the only way to break that bond is to provide another ion to pull them apart back into ammonia and chlorine. That brings up a whole nother ball of wax, and that is what's called a disinfectant byproduct. And so what happens is, when these things pull apart, they release another set of compounds that are, again, pretty toxic. And as I chase those down to determine how to lock them up, I really ran into a brick wall after brick wall. We really just don't have the science yet completely to prove it one way or another. There's just so much contradiction and conflict on these finer compounds that more research has to happen. But bottom line is that when you consume chloramined water or fluoride water, and fluoride's just as bad, and believe it or not, I think it's 4 out of 5 people in the United States of America are consuming fluoride in their water. But let's stick with chlorine for right now, or chloramine. So what I found in the research that I did was that the best way to tie up chloramine is to add in organic matter, believe it or not. And that would be in fulvic acid or humic acid. And I've done a couple extractions here, which I'd love to share about. One of the things you talked about was, forest soil. And I'm presently in Ventura, actually Oxnard, California. So I'm in a very residential suburbia area. We don't have a lot of forest here. So I actually had to go up to Ojai to go into the forested area to collect some forest inoculants. So basically dried leaves, wet, that organic mat between the soil and the surface of the earth. So that's basically what I was using to harvest. And what I got out of it was actually really interesting. This is an extract. So basically, I made this by just taking that forest inoculant. I put it in a plastic bottle, and I cut a little sponge, pop that in the bottom, and I drill a hole in the cap so that the water would leach out. And I put it in a beaker or a glass, and then just let it sit there for a period of time. I was overnight, but you can see, what came out of it is a beautiful combination of fulvic and humic acids. And when I microscoped it, it did not have a lot of biology, but I did have some bacteria, and I have to assume that those are really good beneficial bacteria. I also took some compost, and I did a similar extraction, except for this time I used it without the hole in the cap. So I soaked the compost for a little while, and then I screened it. I squeezed it out. And that I got a little bit darker of a material, so this would be more considered like a humic acid. So as you can see, the color is quite different. But I really think that the combination of fulvic and humic acids is the way to do it. But in the research, what happened was that takes that chloramine, breaks it down to one of these disinfectant byproducts. So then how do I take that disinfected byproduct and break it down again? There's a couple of different ones. I can't even pronounce it. Trihalomethylines is one, THMs. The other one is holistic acid, HAA. The HAA is going to be more complex to get rid of. That one's going to probably take a combination of bubbling, as well as taking it to next step and boiling it for 5 minutes. Now, one of the things that I did also was in the research, it talked about boiling water for 20 minutes, and you can basically blow off all the chloramine. The only problem is after 10 minutes, if I started with 450 mils, I lost 325 mils. So not only did it expend a tremendous amount of energy heating the water, but all I did was really concentrate the fluoride, because the fluoride won't gas off. So I don't think boiling is a good solution. I really think the only combination is to add the organic matter, the fulvic and humic acids, and bubble it for a period of time. And then there's a way to add, where is it? Holy basil, believe it or not. Holy basil at 80 megs per 100 milliliters will, over 8-hour soak, will remove 80% of the fluoride. So now you've eliminated 80% of your fluoride. you've knocked your chloramine way back, you turned it into these other compounds, these DBPs, and then boiling it for 5 minutes, now you've eliminated everything. So I think that is probably going to be the easiest solution, short of reverse osmosis or distillation. But both of those mechanical filtration methods remove all the minerals. And we know how important those minerals, especially the trace minerals, are for our bodies. So again, I think this is pretty much going to be the best way for people to home filter and clean their waters and tie up some of these other chemicals so that they're preventing, further degradation of that gut biome, which we are spending all this time talking about and how important it is. So another site, and just be careful of this, talks about using 100 milliliters of vitamin C to 40 gallons of water to tie up the chloramine. Well, essentially, they just did what we were talking about. By adding that acid, they've turned this into a disinfectant byproduct. So there is just a tremendous amount of misinformation about all these things. But that's where I'm going to rely back on my earliest work as an aquaculturist in aquaponics. We had real issues with these chloramines and these fluorides destroying the aquatic ecosystem, destroying the biology that kept the fish alive. And one of the ways that we dealt with that was to add a little bit of organic matter to the town water to tie up those things and allow the biology to survive and or thrive. So I think I'm less concerned about some of these, these DPBs, because I think in reality, the concern is that in real high doses, they become a problem. So we've eliminated the vast majority of them. We've definitely diluted them. So I think that they're the least of all the evils in dealing with town and city waters. And unfortunately, bottled water is gone. Pauline desperately needs bottled water or clean water that is not loaded with these compounds. And so that's really forced me to really get serious about this. And I did a little experiment here with a way to make a homemade system. This is just a little bubbler, a couple of plastic jugs. I'll add a little bit of this fulvic acid in here. I'll add a little bit of holy basil. I'll let it bubble for 8 hours. And that will serve as a clean water source for her once we start to actually run out of the bottled water that we have left. So I highly encourage people to read up on this stuff so they understand what they're doing. And I think the most important thing is if you do not have a source of clean compost, reach out to the DEM peer crew, reach out to the farmers, have them send you a baggie of it. You don't need a tremendous amount. All you're trying to do is extract a small amount of this stuff just to tie up those two compounds. And if you can, ideally, wildcraft, that's great, but you really have to use common sense and think about where you are and where you're crafting, because there's a lot of situations where you could be getting pesticides, synthetic fertilizers, or any of these other things accidentally when you're crafting. So really craft responsibly and use your head.
Thank you so much. I appreciate that. And water is the key to life. So we're all water. So, if we don't have a good water source, it's hard to be, a really healthy human.
Mm-hmm. And Dr. Holly Hall, she had just left, but she, her whole life is on water. And I just wanted to read to you all what she had said, what she was going to present on today, which it just says that, this virus is going to critically dehydrate people. So it's really important to be drinking a lot of immune boosting teas, sipping on bone broths and different broths that people like to do. And, upping your water count now so that if you do get the illness, that you aren't getting the illness coming into it totally dehydrated. So during this time of isolation, let's do a lot of water drinking, a lot of tea drinking, a lot of bone broth drinking. She also says to make sure to prepare everything at room temperature so that your body is easily to assimilate it. In Chinese medicine and lots of other different therapies, Ayurvedic, water is more easily absorbable by the body when it's at room temperature rather than cold. So warm or room temperature. And it also says a minimum of 15 gallons of water that people should store at their house per person. So, you know, in case the illness does come into your household, that you do have a lot of water stored, that you know that is safe and that you know that is good and potable. She also says to replace your water filters now while you can. A lot of people have water filters, and Leighton was talking about that. Let's go out and replace those water filters now before, you know, it's too late. And she was saying that rural people follow the same protocol to ensure access to clean water, also should they get sick. So, you know, water is a really big thing. Let's make sure that our households are totally covered with enough water. We don't know, you know, what always happens to the electricity. A lot of people are on pumps or on city water. So it's just good to be prepared always by having good, clean water at your house.
Stacy, would you like to fill us in on what's happening in your area, in your world, and in your expertise? Did you already feel like you said everything that you needed to?
Yeah.
Yeah, I think so. I think just one comment I had about immunotherapy, because I, you know, have dealt with a lot of cancer patients, and the comments about cannabis and immunotherapy, that came out of a trial out of MD Anderson, where they showed a lower response rate to immunotherapy in patients who were using cannabis. And I think, you know, if you think about what cannabis does, it maintains homeostasis in the body, right? So it's bringing everything back into balance. When we're giving immunotherapy, we are jacking up the immune system. You know, we're artificially making the immune system extra strong so that it can then go after the cancer. So if you think about it, when you use cannabis, it knows that, and it's trying to bring the body back into balance. So that may be why people are not having as good of responses. So I don't think that it's, you know, necessarily, you know, that immunosuppressive for people who have a normal immune system. So I think you have to just put it in perspective, but that doesn't have anything to do with coronavirus. But just wanted to comment on that, because I think, you know, I use a lot of cannabis with my cancer patients, and, you know, it has so many benefits. They're continuing to use it right now through this crisis. I talked to someone yesterday on the phone who's using CBD during the day to help with anxiety, and then using a little more THC at night to help with sleep. And it's really helping her get through it. So, so anyway, I think it's very useful for our cancer patients.
Thank you so much. That's excellent advice. It's been an amazing show. We've had incredible information. I'm just gonna give a few helpful things that people can do during this time. And during this time, you know, what we're seeing right now is not having food on the shelves, maybe not having water, and it's really showing us how reliant we are on outside sources and outside systems. So I really feel like it's a chance for us to really take a look at where we're at right now and plant gardens. And I think it's a good time to make worm farms and create a compost pile at your house and start creating the biology that we're talking about. That now's the time when we're all together. I mean, one beautiful thing that's come out of this virus is no one can travel anywhere, and everyone is, you know, at home with each other. So take this time to connect with each other and you know, go back to the source, and our source is nature. You know, no matter how technologically advanced we get, we're still, you know, we're still a piece of nature, and everything that's out there is what makes up our body. So I just want to encourage people to maybe take a look at your lawn and dig it up. You know, let's get some of these herbs that we've been talking about. Let's get them growing in our yard. Let's start thinking about ways we can save our seeds so that we're, you know, being able to grow gardens in the future. Let's look at sprouting right now and microgreens and ways that we can get nutrient dense foods very quickly in a window. These are ways that we can, you know, not be so reliant on the system. You know, this is a time to create meditative space in your gardens and take that time to connect and ground out and put your hands in the earth. I think right now we just need to kind of cover our bodies with dirt and surround ourselves with that healthy microbiome. So I think those are the things that we can do right now, and we can ferment foods, and we can create food storage and root cellars, and look at ways that we can save our food in the future, because right now, you know, being reliant on outside food sources doesn't make a lot of sense.
And before we end it, we're going to end with Rachel Carleval. Rachel, thank you so much for coming on today. She's from Ganja Sana. She's been holding a beautiful centerpiece, you know, in a lot of chaos in communities, and helping a lot of people out around the globe in the work that she's doing on a spiritual level, as well as on a real physical level with her yoga practice. And one more thing before I wanted to turn it over to you, Rachel, and to sort of end this, we're going to have many more series to come, so just watch for them, is that we're all talking about cannabis and how cannabis is good for us, but we haven't mentioned what good cannabis is. Not all cannabis is treated the same. A lot of cannabis is grown out there with heavy pesticides, fungicides, heavy fertilizers. And I'm really encouraging you all to know who your grower is. Ask the dispensaries, was this grown organically? Because we know that when it's grown organically, that it's going to have that endophytes that we had talked about. It's going to have all of the uptake of the good minerals. It's going to be able to reach its full potential when it comes from healthy soil, as well as a healthy gardener. So let's, you know, good cannabis is really important.
And also go on walks, go out in nature. You know, now's the time that the pollution is at an all-time low right now in the world. So go enjoy it. Rachel, please tell us about your work and help us. Thank you.
Thank you so much for having me, and I appreciate everyone who has shared their input. It's so wonderful to have this community come together in light and really be able to share each of our gifts and our skills. And I think that's really what it's all about when we talk about these types of tools like permaculture and working with all the different plant medicines and working with the earth in that way. So I'm really honored to be a part of it all. And when we look at what we yoga and meditation and mindfulness, and really the root of some of those practices come from Ayurveda, which is the science of life. And so a couple of things I did want to share that we can just incorporate into our everyday practices and help to boost our immune systems, and things that we could be doing every day, morning and night, just as preventative measures. And one of those things is practicing dinacharya, which is your morning routine. And so especially during times of quarantine like this, it can be very helpful to have a type of routine or ritual that is really a sacred moment in our day where we take this practice for self-care. And so I wanted to share my morning routine just as an example. Trying to awake with the sunshine as the sun rises, drinking lemon water as the first thing in your morning, having some type of hydration with that lemon in there. Then practicing pranayama, which is a breathing technique, and I'll go over that in a moment. Some breathing techniques that we could use to boost our immune system and also to increase our sense of calm and peacefulness in our daily lives. Also practicing gratitude, and then having good dental care, making sure you have some type of routine. In permaculture, we call it stacking functions. So I love to stack functions while I brush my teeth. I have a certain poem, which I'll read for you all later. And you can say different mantras to keep track of time. I know when I water my plants, for example, I'll say a mantra to keep track of time. So you can do that while you have your dental care. And something else you can incorporate for dental care is a tongue scraper. And if you don't have one of these, you can just use a basic spoon from your kitchen. And you're going to go from the back of the tongue to the front and pull down, and do that until there's probably nothing left on there. And that's because within our tongue, each point correlates to the organs in our body. So it's like we're really cleaning out and polishing our whole entire systems just in through our dental care and our mouth. So it's a great practice to incorporate into your daily life. And then also having some type of affirmation for your day, a sankalpa, an intention to set your day. What is your goal for today? And really letting that be your anchor that guides you. It can be confusing in these times, especially when we are in our homes and getting off our normal typical schedule. So having that affirmation that you just sit and take a moment every morning to find gratitude for waking up on this planet and thinking about what's your purpose in this life and how can every step you take today really serve that purpose. I also like to practice hygiene, self-care, showering, and before that doing some type of dry brush rubbing on the whole body. Our skin is our largest organ, and so doing self-care for the skin is great for boosting the immune system, the lymphatic system, and incorporating that with different herbs as well. So here's a example of coconut husk if you're looking on the video, and you would just start on your feet. You can go up and down, and you always want to move towards the heart. And in general, we say circles around your ankles and up on your limbs of your bones. And so we're always increasing that movement, especially if we're stagnant in our homes. And then you can use some type of abhyanga or oil on the body, which is the self massage, especially if you have some type of CBD oil, or if you make a cannabis coconut oil is great. Also sesame seed oil is another nice one, almond oil. And that again, you would rub on the whole body towards the center of the heart, and that increases immunity. Great for the skin, especially nice in winter. I know here in Colorado, I'm up in the mountains, we have over a foot of snow right now, so trying to keep nice and hydrated and everything functioning. So without further ado, I'd like to invite everyone to join me in a guided meditation. And this is something we can call on anytime throughout our days, and really focusing on what we call the central nervous system, the autonomic nervous system. And we have the parasympathetic and the sympathetic, and our bodies are either in one or the other. We're either resting and digesting and assimilating all the nutrients, or we're in this state of fight or flight or fear. And so, in a really quick, simple way to switch from the fight or flight into that nice parasympathetic mode is through our breath. Our breath is such a divine tool where it can either be voluntary or involuntary. And so you have the conscious choice every day to practice the breath, especially with a type of virus going around that affects the lungs. It's important that we cultivate this power and this energy that's innate within our lungs and in our system of what we call prana, this breath of life. So all the breath of life begins in our navel and your umbilical cord. Every single one of us, this is the first place we receive nutrients in our body, right in your belly button. So if you want to take your two middle fingers, place them on your belly button, just sitting natural. And then as you take an inhalation, your lips are closed. We're going to breathe in through our nose and then inflate the belly like a balloon is inflating with air. And you're going to start to feel those middle fingers separate as you draw the air into the low abdomen, really filling up that pelvic bowl with your oxygen. And this might feel different. A lot of people tend to have a short, shallow breath. So really take the time to see if you can inhale through the nose and really fill up to your wholeness, to your fullness right there in the belly. Pause for a moment. And then when you're ready to exhale, the navel initiates the exhalation. So as we breathe out, again, your lips are closed. We're going to breathe out through our nose and just simply tuck your belly button back towards your spine as you let the breath come out through your nostrils. You can close your eyes if that feels comfortable to you. And then slowly inhale again, filling up the belly, filling up the chest, breathing into your wholeness, into your fullness, relaxing your shoulders away from the ears. And then as you exhale, the navel draws to the back of the spine, drawing all the way back behind the ribs, letting all the last breath. It's like you're cleaning out the corners, the crevasses of your body, of the lungs, of the organs, the intestines with the breath. Good. Hold here. And then inhale when you're ready, breathe it all in. And then I'd like to invite in a count here. So to switch our nervous system from that sympathetic to the parasympathetic, we want to do what's called prolonging our exhalation. So when you're ready, I invite you to inhale on a count of 2, just breathing in 1, 2, Fill up and pause for 2. 1, 2. Now we're going to exhale for 4, 3, 2, 1. Hold for 2, 1. Now inhale 1, 2. Hold 1, 2. And exhale 4, 3, 2, 1. We're going to continue. Pause 2, 1. And then inhale 2, 1. Hold 2, 1. And exhale 4, 3, 2, 1. And now you can continue on your own pace here, breathing. And if this is feeling like you'd like to go further and deeper, you can alternate the breath, inhaling for up to 8 and exhaling out 16. So we're always going to want to double whatever number we're breathing out, and see on those holds too, as you find the different pauses, noticing the in-between space. Viktor Frankl, he is one who survived the Holocaust and a great philosopher and writer and researcher. And he says that it's in that pause in between the stimulus where we have the responsibility and the choice, where we can choose to respond. And so as we learn to use our breath, we can use that to our greatest ability to find that pause. And that controls everything. There's been so much work done at looking at pranayama and yoga and the works of meditation in Harvard Medical School, for example, seeing how it can alter our microbiome, our endocrine systems, the hormones our bodies are producing. And so it's so powerful. So I encourage you every morning to just sit for at least 2 minutes. So that's 120 seconds. Set a timer and then allow yourself just to work with the breath. There's no right or wrong way to do it, as long as you're sitting and doing. It's always that time where we can practice being here now. So I hope everyone has a healthy and happy rest of your day today and time together. And so honored to work with everyone and supporting each other. So please feel free to reach out if you have further questions about these practices, Dinacharya, starting your morning routines, and how you can incorporate that into your daily lifestyle.
Thank you so much, Rachel. Such important information. And I think, you know, before we all leave here, there was so much information. And I think that the strongest point that it seemed to funnel through every single one of us who was talking was the word love, and the importance that, yes, we are in isolation, but it's really interesting to think about us as a human body. You know, we think in an isolation also. So I don't think that, you know, we can use isolation or even media or a lot of the things that are coming out, you know, about this particular virus to live in fear. I think we have the ability and we have the control within our own being and our own body and in our own families to be able to really find the power in this. Where is the opportunity here? Where is it that we can learn? Where is it that we can come together better as a human species? How can we omit the fear and live in the love? And a wise person said to me a long time ago that, you know, love is all there is and all the rest is noise. So let's just really listen to the love and the connectivity that we have as human beings here on this planet.
I just say, don't believe the hype, believe the hyphae. So go build some gardens. I would like to have everyone close out by telling everyone where they can learn more about you and your network, and you know, further connect with you in the future.
Stacy, you can go ahead.
Maybe starting with Stacy.
So I am at Sutter Medical Group in Sacramento and in Roseville. So if anybody wants to check it out, they can just find me on the web. I only currently see cancer patients right now, and I work with them in an integrative fashion.
I'm jhergmd@gmail.com, and I'd welcome anybody's questions or comments. I'm in practice in Sebastopol. So again, jhergmd@gmail.com.
Thank you so much, Terry.
I'm Terry Willard, and I can be found the easiest at wildrosecollege.com, where we have many different correspondence courses, including within a few days a cannabis course that's now gone through beta testing, et cetera, et cetera. So we're releasing it in April with obviously a big release around 4/20 for some reason. We're going to be looking at that. So, but we have all kinds of herbal courses, all the way from the introductory ones all the way up to the very advanced clinical ones. And you can get a hold of me that way, the easiest, or you can go to drterrywillard.com.
All right.
Leighton, how can people find you?
I'm a mouthful. My name is Leighton, Leighton. You can get me at Kingdom Aquaponics, LLC.com. Probably the easiest place to find me is Instagram. Again, Kingdom Aquaponics, LLC. And then I can pass along emails from there. But thank you guys so much for putting this on. And I think you really said some beautiful things today. And I bet a lot of people got some good information. So kudos to you guys. Big ups.
Rachel, how can people find you?
Hey, Josh. So I am at Rachel, RICHAEL, at Ganjasana, GANJASANA.com, and just www.ganjasana.com on social media and everything. And so, yeah, I would love to connect with everyone. So please feel free to reach out.
Thank you so much.
And our amazing, wonderful, unbelievable host, Marcus. Thank you so much. You have offered us your channel. You continue to trudge forward on good information for people. You've been an incredible leader in this cannabis industry. And I've always called you an incredible conduit to all good things too. So I don't know if you wanted to have anything to say or how people can reach out to you, but we just want to thank you from the bottom of our hearts for holding this channel and for us to be able to go live on YouTube to everybody today. You're the dude.
Awesome. Well, listen, thank you guys. It was great to have a panel that I didn't have to moderate or talk at all. That was the least I've ever spoken in one of these couple-hour conferences. So I do appreciate that. And I appreciated meeting all the new people that you guys brought in, both Josh and Kelly. So thank you for that. It was nice to see Ethan, as always. And yeah, you guys know where to find me. I'm right here on Bubble Man's World. May the full melt bless your bowl sooner than later. Peace out.
And on that note, maybe there could be a mother lover moment, for the audience. I think that could be appropriate at this moment. So, put one in the air for the family.
Mm-hmm. And Rachel, did you have a poem that you wanted to end with?
Yes, I do actually. So this is called A Precious Human Life. And this is a poem I like to read every morning for my morning dinacharya. Every day, think as you wake up. Today, I am fortunate to have woken up. I am alive. I have a precious human life. I am not going to waste it. I am going to use all my energies to develop myself, to expand my heart out to others, to achieve enlightenment for all the benefit of all the beings. I'm going to have kind thoughts towards others. I'm not going to get angry or think badly about others. I'm going to benefit others as much as I can. And this was written by His Holiness, the Dalai Lama.
Thank you so much. Give thanks to everyone who's out there. Do your best. It's crazy times. And, if we can all just be together somehow, then maybe we'll get through it in a way that's positive. So give thanks for this moment.
Thank you all so much for being here. Blessings and love to every single soul who's out there struggling in this pandemic right now. Special thanks, especially to you, Stacy and Jeffrey, to all of the healthcare providers who will not be home with their family because they are giving up, you know, that time away to be on the forefront and helping out people who are going to be getting sick. I just have so much gratitude for this incredible human culture and this human race that we have here on the planet. And I know that people are watching from all over the world. Thank you so much. We will continue to have these series, and just go out there and inspire, inspire, inspire.
And thank you, Terry, for all your years of herbal knowledge. We appreciate you entering our community here, and you're a wealth of knowledge. And, you know, thank you so much to your whole family, because, you know, you have a legacy underneath you, and we acknowledge that. So thank you. Blessings, everyone.
Take care. Thank you so much.